Hello, Facebook. I want to introduce Dr. Yosh Taguchi, urologist in Montreal. We're going to be talking prostate and prostate cancer, and so glad to have you with us. Thank you very much.
Thank you.
Hope you enjoy the show. We already, can you hear me okay? We already have a caller for you,
Okay.
a patient of the doctor from Chateauguay. Hopefully we'll be able to have some time to get to that. Coming on in just a couple minutes. On the commercials. Lot of commercials. Sorry. Gonna be in soon. Rating men, welcome to Life Unrehearsed on a beautiful Sunday afternoon. Stephanie Erickson is on vacation today, so we took the liberty, as I'm flying solo, to call this one the Guy Show. And my name is Matt DelVecchio. I specialize in free retirement home search and senior transition support. And this is Life Unrehearsed, where we talk about the ins and outs of family life, and specifically some of the guy lives here. We are very, very privileged to have as our next guest Dr. Yosh Taguchi, renowned urologist at the Royal Vic, professor at McGill University, and who's recently retired at the ripe old age of 83 years, young and going strong. He has literally seen it all in his time and very well respected in the community. Dr. Yosh Taguchi, welcome to the show.
Thank you, man.
So happy to have you. Prostate is such an important issue, becoming even more important when in the media, and you hear about Movember. But first I want to start with yourself. Recently retired, 83. Let's go way back. When did you first start, and how many years have you been doing this?
Well, I started practice in 66, started training in 61 in urology. So, it's more than half a century.
Amazing.
I practiced 52, 53 years.
Incredible. And I think at one point in time you actually headed up the McGill urology.
Well, I was heading the training program, yes.
Very good, very good. Well, you've literally treated tens of thousands of patients. And just on the vasectomy level alone, how many was it you said you've done in your career?
I figure it's between 8 and 10,000.
So you literally have seen it all. Unbelievable. But we're going to focus in on prostate and prostate cancer, your specialty, and it's certainly very important for many men. And just some of the stats are mind-boggling. It's the most common cancer amongst Canadian men, excluding non-melanoma skin cancer. 1 in 7 men will develop prostate cancer, and 1 in 29 men will die from prostate cancer. Very, very daunting statistics.
Absolutely. Yeah.
But I guess what I can say, from the time you started in your 60s to now, these statistics are going in the right direction.
Yes, because we haven't found the magic formula how to avoid this, but we have found that you can make an early diagnosis, and early diagnosis translates into a cure. The problem is missing that opportunity for an early diagnosis.
Yeah, and we're certainly going to talk about that. That's probably the most important part. In fact, if in all your time of the research you've done and the technology and the science that's developed, what has been the most important development, would you say?
Well, as a practitioner in the hospital, we used to see older men in agonizing pain from advanced prostate cancer. We don't see that anymore. And that's startling. And I think we are winning this battle a bit in terms of making the earlier diagnosis, curing a lot more people.
So early diagnosis is key. And so what is it through medication? Is it through PSA tests? Or what is contributing to the early diagnosis?
Regular annual PSA, regular annual rectal examination. That's all you need. Is
there an age that it should start where you're doing these tests?
Late 40s for the first time. And if that's A-okay, then you don't have to go every year. You could skip until you're 50. And then after that, once a year. That's not a big ordeal. Blood tests, simple blood tests, no preparation necessary. It's called PSA, as everybody knows. And a decent rectal exam by a competent urologist once a year.
And what if your GP, you could wait. This is an older man's disease. Wait till you're 55 or 60. How, as a patient, should you respond to that?
I don't think a GP should be making that decision. It's in the young people that we see the very aggressive form of the disease. So getting this blood test, getting a rectal by a urologist, I think will obviate that problem.
So insist on it, and
yes.
I think that's, from that alone, just think how many cases can be diagnosed earlier rather than...
And at the other end, as we get older, there's a movement to stop doing the test at a certain age, like around age 70 or so. I was seeing patients who tell me, my doctor told me I no longer need this. And I would tell them, go back to your doctor and ask him, okay, doc, when am I going to die? Because it presumes he knows. And it doesn't.
That's a very interesting point. So just what you're saying, just keep asking.
Right.
Keep asking for the test, and don't give up, and it doesn't matter what age.
Exactly.
Very good. Now, let's go through a scenario where there has been a diagnosis, and it is prostate cancer. Obviously, that affects the individual, it affects the families. And we don't have enough time in today's show, but in terms of most popular treatments these days, what options do we have?
If we have it early, First of all, it's not one disease. There's a relatively benign form, there's a medium stage or medium grade, and a very aggressive form. We know this from the microscopic appearance on the biopsy. So if it's a low grade and less than half the biopsies are positive, we would advise doing nothing but to follow. And about 30% may progress, 70% will not progress.
You're listening to Life Unrehearsed, and this is Dr. Yosh Taguchi. We're talking prostate and prostate cancer. So you're seeing that, and then now...
If you're now seeing a medium grade cancer or an aggressive cancer, but it's still confined to the prostate, you can be cured with surgery. It's the best option for a cure, although radiotherapy is not a bad second. And as most people know, the surgery can be robotic or the old-fashioned way. That doesn't seem to make a whole lot of difference in terms of cure rates.
So just on that point, with technology, robotic therapy is becoming more and more popular, perhaps more accurate, but you were saying beforehand that if you have a urologist that has been doing it and understands it and has had 400, 500, 600 under their belt, that might even be the better solution.
Correct. If I had a surgeon that needed, or if I had the problem and needed surgery and I was younger, yeah, if a guy has done 500, I would happily place my body
in his hands.
In his hands.
And yet I think it's only fair to say that obviously robotic surgery will become more and more popular,
yes,
easier to teach surgeons,
yes,
and
yes.
also...
easier on the patient, easier on the doctor.
Interesting. Also a lot more expensive.
Yes, yes, unfortunately that is true. But radiotherapy as an option is not a bad second. You know, if a person is not fit for surgery, perhaps a bit older, it should not be viewed as I had to settle on radiotherapy because of this or because of that. You know, for many people, it might be the first.
Might be the right solution. We'll tell you what, we're going to talk about a couple more treatments. We also have another person on the line that has gone through surgery, and we're going to hear from him about his experience with it. But first, we're going to head to the CJD Traffic Center for a traffic update. Excellent, excellent. Way to go. So, before we get to my friend Mike, in terms of treatments, we've tackled surgery, both types. We've talked in radio. Is that?
We haven't talked about hormone therapy.
Right. Okay. So I'll lead into. We've talked to a couple therapies. What other therapies that are popular? And so you talked about hormone.
Okay.
Is there one other one?
And we might also mention that why there might be a little reluctance to investigate whether you have it or not. This is a fear of incontinence, fear of impotence.
Okay. Okay. Very good. And then that will lead right into the caller who didn't have the fear, who got the PSA done, and we'll try to make it a feel-good story.
Sure.
And at 56, we're out. So
that's right. It
goes by so quick.
That's right.
So you know what? We'll talk about hormonal therapy really quick, but I think we have to tackle reluctance and concerns about that. We have to do it. And would it be their concerns about their erectile dysfunction or what other?
Why they're not going regularly, getting their PSAs or going to the doctor? Because, well, they might end up impotent or incontinent, and they'd rather live with, with a head in the sand.
Right. And when in fact that's not always the case.
No.
Okay. Very good. Yeah. So we're going to have to be really quick.
Quick. Yes.
Yeah.
Yes.
Dr. Taguchi, if a person pees a lot, is it because of drinking a lot of liquids throughout the day or a sign of prostate trouble?
Could be either. Doesn't mean one or the other. But if they're bothered by going too often, if it's easy to go, the first thing to do is to see you cut out fluid and see if it changes the pattern. That was the question?
Yeah.
Somebody?
Yeah. And that's a common question. Even me.
Sure.
I go in the middle of the night. I can't go past 2 or 3 a.m.
Try cutting down afternoon and evening fluid intake and see if it makes a difference. If it does, don't cut down the total volume will be taken over 24 hours, but changes. So more in the morning, less in the afternoon, almost nothing in the evening.
So many different topics we could tackle
exactly.
together.
Yeah.
So there will
we
be
could have a couple of hours in.
Yeah. Did you call it radiotherapy?
Radiotherapy.
Radio. Radiotherapy. Okay. Still filming, good stuff. What a man, and we could say that to Dr. Taguchi as well. He's helped a lot of men. I'm Matt DelVecchio. You're listening to Life Unrehearsed. Doctor, we talked about treatments, we've talked about radiotherapy, we've talked about surgery. You wanted to mention one more in terms of potential therapies.
Radiotherapy and hormonal therapy and chemotherapy are the options we didn't talk about. You know, if surgery for cure, radiotherapy for cure, and then hormone therapy for control of disease, and chemotherapy. The new hormone and chemotherapy today are things we did not have 20 years ago, and it's keeping a lot of men alive and well.
It's great. It's great, and it's nice to see where technology is. This is real proof that you're seeing firsthand, and a lot of men have seen firsthand. Before we get to a call-in, Mike, who has had surgery, a common question, though, Dr. Taguchi, is one thing you've brought up, that what happens if I constantly have to urinate? I have to get up in the middle of the night. I always have to pee, especially if you're in your 40s or 50s, and should we worry about that? And I use we because I'm definitely one of those guys that are doing it.
Yeah, it's very, very common, particularly as we get older. And it can be due to a disorder. It can be also due to bad habit. If you're drinking too much fluids, for example, that's the first thing we recommend. Cut down the fluids and see if that changes the pattern. And if you're still very much troubled by it, we have a dozen medications that can relax the muscles of the bladder so you would go less often. They do have side effects, constipation, dry mouth, but you trial and error, you could find a pattern that will help.
Okay, good to know. Very good to know. Well, we're going to go right to the line here, and on the line we have a very good friend of mine, Mike. He's actually in Toronto. At the age of 50, this was last year, he was diagnosed with prostate cancer. He's been through a lot of what you're talking about, and he chose the route of surgery. And we're going to talk a little bit about the surgery. He's now, I think it was in September, but Mike, are you on the line? Hey, Mike, welcome to the show. Thanks for being with us, and we have Dr. Taguchi here with us. And Mike, obviously your life got turned upside down about 2 years ago, and you had this diagnosis of prostate cancer. After consultation and lots of research, you ended up having surgery for the removal of your prostate, if I understand, last September. Is that correct? And just on that note, because we were talking off here about that robotic surgery, you chose that, and Mike's in Toronto, so Dr. Taguchi, robotic surgery available in Montreal, no problem?
No problem.
Okay,
Yeah.
Wonderful. And you were mentioning that in Montreal and Toronto, in terms of technology and research, you're
As
on
good
par.
as anywhere in the world. Yeah.
Wonderful to hear. So, Mike, you chose that route. Obviously, a major event in your life and for your family, and I'm sure you had a whole list of mixed emotions. If we could say, what got you to that stage? How did you find out, and what could you recommend to others? So, Mike, just on that point, and doctor, I should ask, is it genetic in nature? Should people be
Yes,
concerned?
if your father had it, your chances goes up 20%.
20%. Okay, so Mike, your father had it, so you had a little bit of a red flag, and you were really watching it and starting with some PSA tests.
Smart. Mm-hmm. That is correct. Yep. Yep. What's your PSA now?
And that's such good news, and
Sure.
Mike and Dr. Taguchi, we could be talking forever here. Unfortunately, we do have to wrap it up. Mike, the latest test results, you mentioned undetectable, so I guess in terms of good news, you can't get better than that. Well, good for you. You're a trooper, and wish you continued success and good health, Mike. Thank you for joining us on the show and taking a little time out of your day. And Dr. Taguchi, thank you so much. You've written a couple best-selling books, and if people need to reach you, I guess you were saying just Google Dr. Taguchi, right? And
I'm there.
Wonderful. And you've got a fourth book in the works. We'll throw that as a little bit of a teaser and a little semi-autobiography, I think you were saying?
Yeah, my third book was semi-autobiographical.
Oh, third one. Okay.
Yeah.
All right. And the fourth one?
It's on aging.
Aging. Okay, wonderful. Well, thank you so much. So informative. I'm sure.
Thank you for inviting me, Matt. It was fun.
Our pleasure. And thank you for listening to Life Unrehearsed. Next week, please join us. We have Myra Gaburovich, author of Survivors of the Holocaust, How Aging and Caregiving Impact this Population and Seniors. And back by popular demand, we'll have Corey Sirota-Frankel, who is a grief specialist. This time, we're going to be talking about grief regarding to the family pet. And we've done a couple shows on pets and grief, and this one should be quite interesting. Thank you for listening. You can catch us every Sunday live here on CGAD from 4 to 5. Let's head to news shortly. Done.
Sure. Wow. Yeah, you do a fantastic show.
Thank you so much.
Yeah, I have a favor.
Sure. Yeah, I'll get you all fixed up. Thank you.
Oh,
You get to wave goodbye to the Facebook crowd.
Yeah.
I'll turn that off. See you later.
No, it's